everyone. Earlier, we told you about Torsia, a 36-year-old viewer who, for 4 years, has been dealing with the aftermath of a devastating freak accident. Now, part of a car transmission flew through her windshield, resulting in severe injuries to her face. Weeks ago, Leah and I delivered the good news to Torsia that she was about to begin a life-changing journey. Check this out.
Torsia, we know the last 4 years have been incredibly difficult, but here at FABLife, we want to give you your life back. It's time for you to feel fun and beautiful because we know that you are.
And we're giving you a reason to beam. You're getting a brand new smile, new teeth, new lips, a whole new you. And we're gonna be with you every step of the way. We'll see you soon.
Oh, I'm so happy. Thank you so much. I'm excited to see Dr. Dorfman. I'm excited for him to give me some good news.
Hey, Torsia, I'm Dr. Dorfman.
Hey, it's nice to meet you.
You too. They say that you practice medicine, but dentistry, you gotta do it perfectly. There is no margin for error here. So, Torsia, I just want to show you some of the challenges we have here.
Okay.
If you look at your x-rays, where your upper jaw was broken, this is where they had to wire you back together. You see all that? Here are your implants in the front. And see, they put them nicely in the bone, but unfortunately that bone is way back toward your palate. The implants here, the teeth are gonna be way over here. We don't do that. We always put teeth right on the implant. So in order to give her the smile she needs, I need to actually take those teeth and move them way over here. If I make you a permanent bridge and try to bring your teeth all the way forward, not only is it pretty heroic dentistry, but it's a kind of thing that it's never been done before. We have Dr. Fisher here.
Hey, how are you?
So nice to see
nice
you.
to see you.
And he can revise your lip for you, okay?
We'll straighten out your scar and your little lip. I've been looking at that with the
Okay.
pictures, so that'd be great. Let me just look at your lip real quick while you're going back.
She doesn't have very much of a
There's not-
vestibule
yeah,
at all. You
not
see
much.
that?
Got it.
That's gonna be hard for you too. All right, we're ready to go.
Okay.
All right, Torsia?
Let's do it.
I want to introduce you to my laboratory technician. She's from Da Vinci Dental Studios, okay? The plan is to make you a permanent bridge that looks like real teeth. There we go.
This is it.
This is it.
So excited.
I've done more makeovers than anybody in history. This is the best. Now, Dr. Fisher, he's gonna make your lips look beautiful.
Hello.
Good morning.
Hi, good morning.
It's your big day, huh?
I know, I'm excited.
Dr. Fisher's gonna do a little bit of scar revision on my lips, so he's just gonna make it a little more aesthetically beautiful. Just to give me that golden arch, I'll have heart-shaped lips again.
And the most notable change is, you know, this needs to be higher and this needs to be higher. That's where the difference is.
I'm excited to be a step closer to getting back to the old me.
Joining us now are the doctors who generously performed the correct procedures that Torsia needed. Please welcome Dr. Bill Dorfman, who specializes in cosmetic dentistry, and plastic surgeon Dr. Garth Fisher. Thank you guys both so much for being
You
here.
guys are our angels.
I know you are. You're like guardian angels.
Yeah.
What touched you about this story?
You know, it's tragic when things in life happen like her accident. And a lot of times a tragedy will happen and we move on. Unfortunately, for 4 years, she's been suffering. She couldn't move on because every time she looked in the mirror, she was reminded of what happened. And, you know, every other dentist she saw was afraid to do it because the implants were so far in her palate and there was no way to actually make a smile the way she needed.
Wow. You know, to think about that is just incredible that your surgery was so invasive and that you had
Have
to
you
do so
seen
much.
anything like this before?
Yeah.
I'm gonna be honest with you, this is the first time ever. I mean, I've been practicing for 30 years. I've never done
Was there a moment that you
anything
thought,
like this.
I don't think I can do this?
Yeah. I mean, I'm not gonna lie, yeah. And when you see the result, the end product, I was shocked that it came out as good as it did, but a lot of that was because of what Dr. Fisher did to augment what I did, because it's not all about the smile. The lips were important too.
Well, Bill did an amazing job, and I've seen him do so many makeovers. This was a really spectacular one. And the doctors and the surgeons that took care of her back in 2011 did an amazing job, and you know there's a lot of credit should go to them too. So, but it's really the definition of just being unfair and unfortunate. Just so sad, but it's made a nice change for her.
Yeah, it is. And we actually have Torsha's mom here, Mary, in the audience. Hi, how are you? Mary, what has it been like for you to watch Torsha go through this journey?
It has been horrific. It has been terrible. But I thank God for you. You've done a marvelous job. Thank God for you.
Oh, thank you.
You.
You know, it's funny. I have 3 daughters, and it's like I'll get a phone call. You know, Dad, I can't go to school. I have a zit. I'm like, come on, really? You know, I mean, they don't want to go to school because they have a zit, and it's like this poor girl had to wake up every morning, take her teeth out, put her teeth in. She was afraid to kiss anybody. She was afraid to be intimate with anybody. She was afraid to talk in
Hasn't
interviews.
eaten solid food for 4 years. That's
I mean,
incredible.
imagine talking to somebody and your teeth just fall out.
I can't
it's
imagine
incredible.
that.
It reminds us all to
Incredibly
enjoy the
brave.
moment, be thankful for everything.
That's